Hello, I'm Dr. Camran Nezhat, the founder of the Worldwide Endo March. I would like to greet all the viewers all around the world at any time zone that you are. It is an honor and privilege to be with you, and I would like to thank every one of you, all the patients with endometriosis, their families, their friends, their doctors, all the EndoMarch president, chapters around the world, the ambassadors, the captains, and the volunteers that have, for the past 10 years, have done so much effort to raise awareness about endometriosis. And I have said it many times, if endometriosis was a man's disease, we had more diagnosis and better treatments and hopefully methods of prevention for it. Endometriosis is very, very common. Our research has definitely demonstrated that it is significantly more common than it is assumed so, especially among couples who want to get pregnant. 1 out of 7 couples who try to have children, they have problem getting pregnant. And very often, these couples go through a lot of heartaches, many significant amount of expenses, failed IVFs, so on and so forth, without any success. Many of them have no symptoms at all. All of their tests are completely normal. Their partner's test and semen analysis is completely normal, and they do not get pregnant, and we call it no reason infertility. Our research has demonstrated that more than 90% of these couples have endometriosis, and helping them significantly could increase their wish to have a child. Endometriosis is a social issue. As couples try to have children later and later, then endometriosis is a progressive disease. It progresses and gets worse and worse, and then people have more problem getting pregnant. But indeed, there is help. We can help, and knowledge and science can help a lot of these couples very, very well. We have been trying to address this issue in the Worldwide EndoMarch webinars, and we are very privileged to have our guest today, the physician guest who is a visionary, and she is a gifted reproductive endocrinology and infertility specialist in Los Angeles, who is internationally known, and patients from all over the world travel to see her to gain their wish to get pregnant. A brilliant Dr. Kelly Baek, who has had significant training in endometriosis, infertility. She has been trained at Hopkins, the best institutions in this country, Sinai and Cornell. And she presently practices in Los Angeles. Also, 2 couples of her patients, Roya and her husband Scott, and their daughter Anaya, and also Carly and her husband Zach and their son Jacques. They are also joining our webinar today. We thank you for listening. Past webinars, you can watch them in endomarch.org, and there are many sessions that you can watch. You can ask your questions. We have our fellows, Dr. Shruti Agarwal and Dr. Deborah Lee, and also Dr. Mahkam Tavallaee. They're all also joining us to answer your questions. And we will start, as I said, the endometriosis is a social issue. In developed countries, the birth rate is in some cases less than zero. And in our country, in US, we are going towards that direction. So endometriosis is one of the major issues, and hopefully with your interest that you are raising awareness, we will have better and better results. Saying so, I would like to introduce first you, Dr. Kelly Baek, that I mentioned to you. She is going to express to you her interest and how she sees patients with endometriosis. As I mentioned to you again, she is completely gifted. Practically, we work together on a weekly basis, and we have had numerous patients. I cannot believe how she diagnoses endometriosis, but she is incredible. Dr. Baek, please go ahead.
Dr. Nezhat, thank you so much for having me on your on this forum. And I really I'm so grateful to Roya, Scott, Zach, Carly, and your children for joining us. This is like so kind of you. But I do think that endometriosis is something that does affect a lot of women, and unfortunately is either undiagnosed or misdiagnosed for years. And so I know that we're probably going to go into when and how do we diagnose it, because it's not always that you need a biopsy, and there are times where you can detect it on physical exam. And because the true way to assess endo, if you have a suspicion for it, is laparoscopy, and it is surgery and it's invasive, it's one of those things that we really have to kind of come to an understanding and educate women about, like, when should you seek it. So when you have irregular menstrual cycles, or you have pain, or you have things with GI symptoms that you're being diagnosed as having GI issues, sometimes it could be endo on your colon. And that's what most women are diagnosed as having IBS or irritable bowel, or having something called SIBO, which is a small intestinal bacterial overgrowth. And so I do think that just being able to identify it for women and asking for answers, because a lot of times when women have irregular menstrual cycles, or they have burst ovarian cysts when they're younger, one of the first knee-jerk reactions that they get when they try to seek help is that they're placed on birth control pills. And I think before getting placed on birth control pills, it is good to first try to get some type of answers. And I think I'm really glad for opportunities like this to help educate people. So thank you.
Well, thank you very much, Dr. Baek. So, Roya, how did you end up having the diagnosis of endometriosis, if you don't mind? If you explain your story, and then we can ask Carly to talk about hers later, after you.
Yes, definitely. So yeah, my husband and I started to try to get pregnant right after we got married in 2017. For a year, we tried on our own, and I had about maybe 2 biochemical pregnancies. And as you explained, when Dr. Baek also explained, after a year, my gynecologist said, you know what, I think you need to go to a fertility specialist. And we checked everything, like my hormone levels. I had totally normal periods. I had 0 pain. Everything that, they would checked out for us, and same with Scott. And, this just became a constant, we don't know why you're not getting pregnant. Maybe it's your age. I was 39 at the time. They kept saying, maybe it's your age, maybe it's, something else. They couldn't really figure out what it was. And I was taking a lot of the blame and responsibility myself, that maybe, we should have done something sooner. I should have frozen my eggs. And, all I kept hearing is, we don't know why this isn't happening. Everything looks normal. Everything looks fine. So I did about 6 rounds of IVF at one clinic, and we got nowhere. I never got one genetically normal embryo ever. And then is when I got recommended to go to Dr. Baek, and I did about, I think, another 3 or 4 rounds with her. And in between, we were always trying on our own, and we never had any success. And I did feel that a number of times that, we would get around the implantation phase that, you know, I would have implantation bleeding, or, you know, I felt like something was trying to happen and it wouldn't. And we, even with Dr. Baek, we never got a normal embryo, never, even though we would get, you know, and I had a lot of, you know, eggs, I guess, for my age, and we would get to blastocyst, but we never got a genetically normal embryo. And then in that process, when I was with her, is when I told her, you know, a lot of times when we try naturally to get pregnant, I feel like something's trying to take, but it doesn't seem to work out. And, you know, I read online myself, I did some reading about checking my uterus and abnormal cells. And when I discussed it with Dr. Baek, and I told her, you know, no one's ever checked my uterus before. Is there something further that we should be checking? She said, sure, I could T on you, which is an endometrial function test, and it'll biopsy and we can send it out, and that'll give us a lot of answers. So once she did that, the answers came back and the results were endometriosis. And she said at that point, this is 4 years, I guess, into the making now that we had been doing IVF, 3 to 4 years. And she said, you know, at this point, there's moving forward with IVF, there's nothing else. You need to have surgery and have this removed. And my biggest recommendation is that you go to Dr. Nezhat. He's the best. He's, you know, world known, and everybody goes to him, and he's wonderful. And I recommend that you go to him. And, you know, until you do this procedure, until you do this, you don't have a chance of getting pregnant, because not only does endometriosis implantation, but it can also cause you not to get genetically normal embryos, which that was also something that I didn't know and I wasn't aware of. But she also educated us on that, saying that, you know, this is also, it makes sense that we're not getting any genetically normal embryos, because if the endometriosis is pretty bad, we wouldn't be able to get embryos either. And when we came to you, you were very confident and pretty confident that if I did the surgery, that, you know, afterwards, most likely our percentage of being able to get pregnant would be something around like 70%, I think you had said. Once you go in is when you'll really be able to notice, you know, how bad the endometriosis was. And I think after the surgery is when you came in and you told me, you know, you had no chance of being able to get pregnant on your own or through IVF, because I had endometriosis everywhere. Apparently I had it on my uterus, my ovaries, my rectum, my bladder. It was everywhere and not one symptom. So, and then after seeing Dr. Nezhat, after not the first month, but the second month, we got pregnant with her, and naturally, and it was like a miracle. I didn't believe it. When Dr. Nezhat told me, like, you know, after this, you can get pregnant on your own, I said, oh my God, after everything we've gone through, it can't be that easy. But, and Dr. Baek said to me, you know what, I don't recommend you doing IVF. You just had this surgery, you know, you're still healing from it. And, you know, the IVF and the hormones can bring back the endometriosis, you know, at some point. You've never tried, you know, naturally on a normal playing field. Now that we know we've resolved the issue, I think you should try on your own. And I was very skeptical of doing that because I have diabetes and I was a high risk patient. I'm now in my 40s. It's been a few years since we started. So there were a lot of, you know, things to take into consideration that I was very fearful of, but I figured, you know what, this is the only way to do it at this point. I came more IVF and I had done 10 rounds up until that point. And so we gave it a shot, and 2 months later, we were pregnant with Anaya. So, I mean, it was a long road, but thank God for Dr. Baek and thank God for Dr. Nezhat. I had heard about endometriosis. I had friends who had had it before, but I didn't really know what it was until it actually happened to me. And I think that educating people and letting them know that they cannot have symptoms, or, you know, that there is even what endometriosis is and how it can affect your reproductive system. I don't think many people know about it. So I think doing this is very, very beneficial to people. And I can't thank Dr. Baek, Dr. Nezhat for their existence and for their knowledge and for being so amazing. I mean, if it wasn't for you guys, we would have never been here. So thank you for being such amazing doctors. because those are hard to find too these days. We owe it all to you.
Well, thank you very much, Roya. You are very kind to say that. But Dr. Baek, how do you feel about, in general, the patient with endometriosis? Is there anything, comments that you would like to give, the difference or the age difference of as the patient getting older? Do you have any specific recommendations for younger patients, female and also male, about freezing their eggs and sperm? How do you feel about that? Roya brought that up.
This is something where oftentimes when I suspect endo in younger women, because I have a lot of women who come in their 20s and 30s for egg freezing. When I have a younger woman and they have a lower number of eggs for their age, you typically see about 10 to 20 follicles on each side, or they have a very low AMH. Their AMH should be like 5 to 8 and it's less than 1. And they have really no other significant red flags. They don't have a history of smoking or vaping or have an autoimmune issue or had pelvic surgery or infections. One of the first things I try to rule out is endometriosis. And I look for any potential physical findings, whether their uterus is deviated to the right or the left, if there's a thickening of their uterosacral ligaments. But when you have a young woman who comes in just for a fertility assessment and they have a lower number, I think that, and there's no other red flags, I always rule out endometriosis. So that's like one category of patients. And usually, they're asymptomatic. They came in for something elective. They're usually angry when I bring it up because they just want me to freeze their eggs, but they don't understand that, like, if you have endo and I freeze your eggs, it's not going to work. The eggs are not going to thaw well. You're going to go through the motions. It's not my recommendation. And can you find a doctor who'll freeze your eggs? Of course, you can go anywhere and they'll freeze your eggs. But you have to make sure, is it medically appropriate for you, and really make sure that you have the information so you can really make the appropriate choices for your fertility. That's one. The second is if you have a known uterine defect, like a congenital septum, or there's something abnormal about the uterus, 50% of those women have endometriosis. So I know right away it's something that I'm going to be looking for. If they have a hysterosalpingogram, which is one of the basic fertility evaluations where the radiologist assesses the uterus and the fallopian tubes, and it's really deviated to the right or the left, there's something going on. If they haven't had pelvic surgery to explain that type of deviation to the right or the left, you have to rule out endometriosis. But I have to say, in a case when you have a woman who is closer to 40 or over 40, who has done multiple IVF cycles, they haven't gotten normal embryos, then is it the first thing you're thinking about? No, you're trying to get them a normal embryo because you think, well, 10% of eggs are going to be genetically normal and you don't want them to lose that window. So would I tell them to do endosurgery first? Probably not, because I'd want to not have them lose that window for opportunity. And every time you do IVF, it can make endo worse. So you don't want to address the endo until you're done harvesting embryos. So I just want you to know, like, how I kind of look at different types of patients. But when I have a patient and we have normal embryos, one of the first things I would recommend is, if they've never had children before, making sure we've checked the uterus, that there isn't something on a microscopic level, even if they're completely asymptomatic, because I want to make sure that I've given that embryo every opportunity to be successful. And so in someone who's never had children, once I get normal embryos, I do the endometrial function test. I know there's other tests out there that are commercially available that are backed by Wall Street, but they're not really appropriate for someone who's never had children.
Thank you very much. This is very insightful and very informative, as and our research has shown that patients of yours, or a combination, some other REIs that we work with, and the majority of the couples, more than 90% of them that are trying to have children, all of their tests are normal. The husband test is normal, and they do not get pregnant. We have pathologically proven endometriosis. And all the data has been shown that endometriosis is poisonous to the egg, to the embryo, to the sperm, and also prevents implantation. And the success rate of results of these groups has been so high that I asked one of our fellows, Dr. Shruti Agarwal, to go and double check it, all the data of your patients and Dr. Sunny June and Dr. Tazuka and Dr. Amy Avazadeh, because these are the core groups of patients that we see a lot of their patients. And this has been proven and over. And is Dr. I think Dr. Shruti Agarwal, who is one of our second-year fellow, had a question in that regard, and she had those data. If Shruti is available and you want to ask Dr. Baek that question, Shruti, please go ahead.
Good morning, Dr. Baek. How are you?
Hi, good morning.
It's finally nice to meet you. We see so many of your patients. They speak so highly of you.
Oh, thanks. It's nice to meet you.
Nice to meet you. I think one of our patients is asking this question as well. Can you explain further? Like we have seen with research that endo does affect euploid embryos, and there, people who are harvesting these embryos, they can be abnormal if you have endometriosis. Can you delve on why that is? Why does endo cause that to happen?
Sure. So what endometriosis can do is it can age your ovaries more quickly. And by aging your ovaries more quickly, how does it affect the eggs? Well, it's a machinery of the egg that has to divide normally to get a normal or genetically normal embryo. So if that membrane of the egg is a little bit more fragile because you have an underlying inflammatory environment, which is caused by the endometriosis, that would affect it. Oftentimes, if I know someone has endometriosis, I always trigger ovulation smaller because I know that their eggs will mature potentially at a smaller age. Who matures smaller? Women who, as they start to get older, they'll mature smaller, or if they have endometriosis or any type of autoimmune issue, their eggs tends to be a little bit more fragile, they mature at a smaller size. And so when you do IVF, if you know someone has endometriosis, I always try to trigger at a smaller size so that the machinery of the egg will divide normally, and that's why. And so even if someone has endometriosis and they don't have a lot of follicles, first of all, usually I don't recommend they do egg freezing because I really worry that they're not going to freeze and thaw well, and I don't want to simply go through the motions of it. But if we're doing embryos, even in the scenario of an embryo and you do genetic testing, if someone has endo, people always want to do IVF first. But if we're doing harvesting for the future, I do recommend having the surgery first so that their eggs have a better chance of being normal, responding better to the medication, and so that we have a better chance of getting normal embryos.
Right. And that is the question with a lot of our patients who come to us with infertility, that they are always asking us, should I go ahead and harvest embryos or eggs, then go through surgery in case my ovaries get damaged? And I had looked at some research, and I actually ended up publishing it at ASRM. We looked at about 40 patients who all had endo on their pathology, and before surgery, they were all trying to conceive for about 29 months. And after surgery, they were all able to conceive within 4 months, and all 40 of them were able to get pregnant by embryo transfers, but they shortened that time after surgery. So absolutely,
But
I
the
totally
one
agree
caveat
with
of that is you have to make sure it's someone who doesn't have adenomyosis, which is endometriosis in the muscle. That you have to separate that category. And so that's one of the things that Dr. Nezhat will identify. There are times that when he does surgery, even in someone who's completely asymptomatic, if they have adenomyosis that's in the muscle, I do bring up surrogacy. It's not a fun topic. It's not a, patients are a little shocked, but if you have it, it's better than if they really want to have a genetic child. Those embryos are so precious. So I do want you to know that it's not always the case where if we have a normal embryo, we have surgery. There are times that we learn things intraoperatively that tell us you shouldn't carry a pregnancy. There was a very young woman in her early 30s, Dr. Nezhat may recall her, and she was asymptomatic. Her and her husband did not believe that they had any issues. When Dr. Nezhat went in, her entire pelvis was a concrete, and he actually called me to tell me, this is not correctable. I don't know if you recall, but you called me intraoperatively and said, this is not correctable. And we moved on to surrogacy, and they subsequently have 2 genetic children with surrogacy. But obviously this is an asymptomatic woman who is not expecting this, who went not willingly for surgery, but then when we went in for surgery, she was so grateful that, even Dr. Nezhat couldn't correct this. And so, I do want you to know it's not always that we just tell people, oh, you're going to be able to carry pregnancies. But what we do learn intraoperatively with Dr.
Right.
Nezhat is whether or not you can, and we're not going to waste an embryo. And then the other thing that I want to identify is that it's not simply having endosurgery. Who does your endosurgery, that they're doing an excision therapy, that they're trained in this, really makes a difference. My biggest concern is there's a lot of people who claim to be endosurgeons who unfortunately burn. And when they burn the eggs and they burn the endo, they're not excising and removing the endometriosis. They're not changing the environment. And usually when you burn the eggs, you're burning microscopic eggs. So you're usually putting women to menopause earlier. So I'm very careful. And so whenever patients are upset that I really only refer them to a couple of surgeons, there's a reason why. So I just want you to know, I want to make sure it's not just telling everyone go get endosurgery, because I don't think that's the answer. It's who you do it with and making sure that it really fits along with where your fertility goals are.
Thank you very much,
Okay, thank you.
Dr. Baek and Dr. Agarwal, Shruti. What we often forget is also the couple, the husbands, Scott and Zach here, they go through the process. But I'd like to ask a question about here. Hopefully Roya and Scott stay there. Carly, would you please tell your story and how you were able to achieve your goal and your journey with Dr. Baek and then coming to us in Northern California?
Yeah. Ours started, we didn't know we had any problems with infertility. We just started talking. I was in my late 30s, and we were talking about having kids. We were getting married, and we were like, instead of just trying naturally, if we want to have 2 kids, maybe we should freeze eggs now before we get pregnant with our first, because we thought we'd have no problem. We both are healthy, and none of this crossed our mind at all. And it just never was a possibility in our minds. So we saw Dr. Baek just to freeze eggs and kind of just see what's going on in there, and just kind of casually going in. And then the adventure began, because we did freeze we froze some embryos, and we got 2. And then we decided maybe we should do one more round, because in case, we need to use those and we wanted to have 2 kids, maybe we need to have more. So we did it, and we got 1 more. So we had 3 embryos, and we felt like we were, on a good path and kind of, ready to implant. And luckily, Dr. Baek is one of the most thorough doctors that I've ever met. It was frustrating along the way, because there is a lot of stuff that she wanted to check before we even tried naturally. Dr. Baek, I don't remember the name of the test that you had me go to that doctor where they go in to make sure your tubes are clear.
Right, the hysterosalpingogram.
Yes. So she wanted me to go do that. So I'm like, okay. So then I go do that test, and I'm thinking I'm going to pass everything, and comes back with that one that I have a polyp in my uterus. And so I have to get surgery for that, because if you have a polyp in your uterus, it's going to be really hard for the embryo, maybe impossible for the embryo to implant. And so we went to do that surgery, and there were 5 polyps in there when we actually went and got it done. And then after that, we're going months, because it kind of felt like to me, it always felt like it was going to be this easy thing. And I thought I'd have a bunch of eggs and a bunch of embryos really easily. And everything was just way harder than I thought along the way. And I felt like I kept failing the tests that we would take, and so once we got the polyps out, then she wanted to do the EFT before we did any implantation. And so I was okay with that. And we did that test, and it came back that she suspected that I had endometriosis. And now, because we had done 2, freezings, it's been like a year. We've been trying naturally. She'd been along the way, helping us along with trying naturally with releasing the egg at the time that we needed released. And every month we were negative. Every month we never got pregnant. And so we were starting to get worried that this process that we thought we'd have no problem with, all of a sudden we were infertile, and our tests in every other way were coming back okay. But then when I had the polyps, and when she finally said I had possibly had endometriosis from the EFT test, I was one of those people that was frustrated. I was like, can't we just implant? I don't have any symptoms for endometriosis. Like nobody's ever said I have endometriosis. Now, one thing, just an aside, that I have struggled with my whole life is food issues, or most of my adult life is food issues. And I had no idea that these two things could be connected. I was sensitive to a lot of foods, and it was getting worse through my IVF treatments. I was getting really bloated, and I was seeing this doctor that was doing all these tests and testing me with foods that I was sensitive to at the same time. And all of a sudden I was sensitive to like everything. And I was getting so frustrated because I didn't know, I just felt like my body was falling apart at this point, like I was failing all of these other tests, had polyps, had these surgeries, and then couldn't eat anything because everything I was reacting to. So when she said endometriosis and I started to look into it and saw that that could possibly be something that is causing all of this, then I got a little bit more excited to meet Dr. Nezhat, because she said, you need to see Dr. Nezhat. And I saw that he was in Palo Alto, and I was like, I live in Los Angeles. There's not a doctor here that I can go see. Like I have to fly up there. And she's like, this is who I would see. And when she said that, we really take that to heart. And I trust her. And so we flew up there to meet you. I don't think I've ever been so nervous. I don't know why, to meet a doctor, just because all of it was just unexpected. And I remember my like palms were sweaty. And then the second you walked in, Dr. Nezhat, I was immediately calm. And you just had a way of talking to me about endometriosis that I almost felt excited to get it done, as opposed to scared, where when I was flying up there, I was really scared. And so I was so excited to because I talked to you about my food issues as well as the infertility, and the idea that this could possibly fix all of that was exciting to me, because it was something that I was struggling with, the infertility now for a year and a half and the food stuff for years. So I booked the surgery as quickly as possible. I went to get the pre-op, and which is about 2 weeks before your surgery. And even then, because I don't have any symptoms for endometriosis, my doctor told me, I think you're making a mistake. I don't think you have endometriosis. You don't have any of the symptoms. This is what I think you have. And he's, leaky gut or whatever else it could be. And he really was begging me not to get this surgery. And I said, I really trust the experts. Like I was talking to experts in this subject, so I'm going to go do it. So I went up to get the surgery, and it turned out that I had it really bad. It was everywhere. It was in my colon, it was in my ovaries, it was in my bladder, where you also found a lesion. And so it was in my like back, it was everywhere. And so afterwards I felt immediately better. I mean, there's like a little bit of post-surgery pain, but it is, it's a fairly simple surgery as far as the way that you feel when you wake up. I was in like 3 days, I flew home and was feeling my bloating was gone. Like my food issues were gone afterwards, which already immediately I felt so grateful, because that was something that I was dealing with for so long. And then we were supposed to go to Dr. Baek. This is March 2020. We had the surgery in January, and in March or early April, we were going to go in and do another EFT just to make sure that the endo was gone and that, it didn't start growing back by then. And then we were going to do implant one of the embryos. And obviously then the pandemic hit and everything shut down. And so we couldn't go in to get that done. And that month that we were scheduled to do the EFT that got canceled, we conceived Jack naturally. And we were like completely shocked, because we just didn't, with everything that we had been through up until then, I kind of at that point felt like my body just wasn't playing games. It was just like not playing with me. It was failing, it felt like. So for it to do it on its own felt like a miracle. I remember calling you, Dr. Baek, and being like, no. What? And then I came in and we did the pregnancy test there, and she's like, it's positive. It was just the craziest thing. And then afterwards, my food stuff was completely changed. Like now I don't have all the food sensitivities. I don't have the bloating. So for me, this was life-changing, not only in conceiving my son, who's amazing, and not going through the infertility stuff anymore, but all the uncomfortability that I had with food stuff was gone. So it's completely life-changing. And I wanted to talk about this for a long time because of how life-changing it was for me. And because I didn't have, painful periods or a ton of bleeding. Like I really didn't have anything. And any doctor that I talked to about it along the way really discouraged me from getting the surgery because of that. And so I'm just so grateful that I had such a thorough doctor and Dr. Baek having me do all those tests along the way, getting the polyps out. Like I just felt like this like newborn baby afterwards or something, you know, like my body was working again how it was supposed to. And Dr. Nezhat, like going in there and making me feel so confident and sure that this was the right decision. And then doing such an amazing job of making, you know, I really felt great almost immediately after the surgery. So I am forever grateful for you guys. And, you know, now we have our son and we want to try for another later this year. And so it's just, you know, I have nothing but amazing things to say about this whole process.
Carly, I'd like to thank you very, very much for your kindness to me and also I'm sure Dr. Baek. But what I want to make sure all of you around the world, the viewers know that all the doctors are meaning well, they have good intention, and they like and they love their patient and they want to help their patient. But sometimes what the mind doesn't know, the eyes don't see. And what Carly is very smart about it, she found Dr. Baek, who is brilliant in her work, and she is the expert. And Carly listened to the expert in her area. And although other physicians may mean very well, they have good intentions, it might not be their finest moment of practice because that is not their area. So
Yeah.
That is what I wanted to show. And also one area that it is important is the endometriosis that which, as Dr. Agarwal mentioned, many, and I think Roya was mentioning earlier that about 70% of the patient, it seems recently our data has shown that a lot of these patients, their chance of pregnant is significantly even higher, but they have a lot of them go through IVF. I mean, especially if you are older, if your age group is higher, after about a period that we usually after surgery, perhaps 6 weeks, or every patient is different, they could go through the process of IVF, and the chance of success with IVF and implantation is significantly higher. And now Carly and Roya got lucky, got pregnant spontaneously, and Dr. Baek recommended to them to wait. And during that period of wait, when you listen to your physician, but some cases they have to go ahead and proceed with IVF and the embryo transfer. That is important. And I wanted to see how Dr. Baek decides which patient do you recommend to them to try on their own, and which of them, Dr. Baek, you proceed and you transfer the embryos.
So if there is endometriosis or they have a uterine factor. So if there's a uterine factor, 100%, I'm going to have them try it on their own as long as the tubes are healthy and the sperm is normal. Because if there's a uterine factor, there was no way they could have gotten pregnant. So if you have polyps, or if you have a uterine septum or a fibroid in the uterus, this entire time they were trying, there was no way they would have conceived because there was no place to implant. But in anyone who, when I advise they consider trying to conceive on their own after surgery, I don't like rush people in, is I need to make sure that their tubes are healthy, they don't have endometriosis affecting their uterus, and the sperm is normal. Because 30 to 40% of fertility is male factor. So I'm not going to have someone try in vain if the sperm's not going to meet the egg.
Yeah, thank you very much. Again, this is very, very important that, when there is a combination factor of endometriosis and also male factor, that is why the rate of infertility increases. Mm-hmm. Sometimes the female partner has no endometriosis, and the sperm count is a little bit low, she would get pregnant. Or sometimes both of them, they have a little bit of endometriosis and a little bit of sperm problem, then the infertility is exaggerated. So these are all factors that we evaluate, and the recommendations. It is Dr. Baek's recommendation. Our recommendation is individual. It is not a cookie cutter. Every patient is very differently. And one of our other fellows, Dr. Deborah Lee, she had a question and she wants to ask. And Deborah, go ahead and please ask Dr. Baek.
Yes, good morning. Dr. Baek, it's so nice to meet you. We've really been looking forward to this. And Carly and Roya, thank you so much for sharing your stories. Your children are beautiful.
Thank you.
So, Dr. Baek, we actually have a question from one of the participants in the chat, or one of the people here with us today. You mentioned about the EFT, and one of the things that we often hear from patients is, why didn't my, OBGYN recommend this? Is this something that they can do? Or is this only something that Dr. Nezhat or Dr. Baek can do? Can you tell us a little bit more about how that process works?
Sure. So with the endometrial function test, as with any of the uterine biopsy tests, it's not something that most OBGYNs will be doing. And the reason for that is if you're doing the ERA, which is a different test called the endometrial receptivity assay, it's very time specific, where when you start the progesterone, you have to do the biopsy 120 hours later. And so with most OBGYNs, with the volume of patients that they have and the timing, it's not going to be accurate because they usually aren't able to do it at the right time. For the endometrial function test, I'm going to be honest, this is something that I've seen even other fertility specialists have reached out to me asking how to do it, because they still are confused of how to do it. And so it takes a little time, and you actually have to read and work with the doctors at Yale to figure it out. Because normally when we start progesterone suppositories, you normally start at 200 milligrams. And with the Yale protocol, it starts off at 25 milligrams, which is 1/8 the amount. And so you have to find a compounding pharmacy that can do this. And you also have to understand that we don't do blood work. The whole purpose of the endometrial function test is to know what's happening at the level of the uterine lining. It's microscopic. And so, because most doctors are so used to, if you read the textbook, you're going to do estrogen, progesterone levels, and they think that, oh, the levels are too low, I'm going to up it. And they don't follow the pattern that's recommended by the lab that created this test at Yale. The second thing that I'm really careful about just telling people to do with their gynecologist is that when I do the biopsy, I use a Pipel biopsy that's a straight plastic catheter that has no teeth on it. It can't cause damage. It can't cause scarring. And it's really how you do it. I go in with a full bladder. I do it under ultrasound guidance to make sure I'm getting the right tissue, because all tissue is pink. Because most doctors, when they do an endometrial biopsy, and you're usually doing it for cancer or irregular bleeding in a gynecologist's office, they will use a metal biopsy that can bend. You can get into the uterus easily, but it has teeth on it. And what's the downside of that? Well, if you have endometriosis, you have an inflammatory environment, and you have a biopsy with that, you may have had no uterine problem. And now after this biopsy, you now have scarring inside the uterus called Asherman's, and you are now going to have a difficult time getting pregnant. So it's not something I encourage everyone to do, because if you do it just to go through doing the test, but it's not done appropriately, or you have, even in the best hands, it's how your body responds, because they used an instrument that can actually cause scarring. That's why I'm really hesitant to advise people to do this with a generalist or a fertility specialist who isn't familiar with it, because it can cause harm.
Thank you very much, Dr. Baek. There are a couple of some other questions from the audience that Dr. Agarwal and Dr. Lee are going to ask Dr. Baek. But one component of this infertility couple that often are ignored, or that they get less attention, is the journey of the husband or the partner. Scott and Zach, we start with Scott. Scott, how this process affected you, and how did you cope with it?
It was pretty, to watch your wife go through something that is so emotionally, physically, and mentally taxing on her. And for somebody who being a mom was so important to her and was something that she was not going to get married until she wanted to be a mother with. Watching her go through that and struggle with it was really, really difficult because you want to help and spend 3 years of unanswered questions. And, you know, my wife went through over 18 months, 7 to 9 rounds of IVF, you know, the hormone injections, the mental and emotional anguish that goes with that, the changes, hormones in her body was a struggle for all of us. And, you know, and to watch her mentally break down towards the end. And I think that's what, you know, the greatest gift was the pandemic happened and we had to do, we had to abort one of the IVF cycles with Dr. Baek, and we almost got pregnant. She had all the signs, all the signs of plantation and everything that it says. And we were on day 27, day 28, and then, you know, her period came. And we're like, okay. And that's when, you know, Roya really sort of said something, and no one's listened to her. The previous place we were at, you know, they didn't listen. They didn't, you know, it was a factory, and Dr. Baek sort of really paid attention. And it was the first time that someone listened to her, got the diagnosis, even oh my God, we just go have it. It took us a few months to make the decision to come to, you know, Stanford in the middle of the pandemic, to go up there and drive there. There's no planes. You know, but it affected me, you know, because as a husband, you want to be their support, and it's difficult to watch my wife to go through that. And it was very emotionally taxing.
He was a wonderful partner too, though, because for me, I mean, I don't know. I think for a lot of people who go through IVF, and I'm sure Carly can probably, you know, vouch that, you emotionally, physically, mentally, spiritually, you kind of just break down, you know, and we went through so many rounds of IVF because every single time we thought that this cycle was going to be the magic cycle. Everything is aligned, everything looks good. And we kept thinking, one more time, this is the magic cycle. Okay, one more time. And then we got to a certain point where I thought, I can't take this anymore. And that's when Dr. Baek said, you know, you have to have surgery. And I thought to myself, after everything I've been through, now I have to go get invasive surgery, and there's you know, and Scott was actually the one, you know, I actually told Scott before we came down to see Dr. Nezhat, I said, I have a feeling that once we go down there, I'm not going to be able to go through with this. I don't think that I can do this anymore. And he said, okay, why don't we go? We'll go to Palo Alto. Let's go see Dr. Nezhat. If after him you still think you don't want to do the surgery, you don't have to do it. So he was like, you know, he was so supportive the entire time. I don't think I could have done it without him, and it definitely affected both of us, but I was lucky that I had such a wonderful partner. It was a very hard journey for us, but she's here and we're happy now.
Well, thank you very much, Scott, as well, and Roya and Anaya, for sharing your story. And I was wondering if Carly, if Zach is with you and he has any opinion, but that's very important.
Yeah. I knew absolutely nothing about this, as you can imagine. And I think my journey with it was one, it all started out with, you know, what is this? What are we even talking about? Never heard of it before. And so I think that there was my first reaction was maybe one of, I don't know if it was relief, maybe relief that like, oh, there's a thing that's preventing this from happening. So, okay, like identification, that's the first step. That was a really positive moment of like, okay, there's this thing. Now, what do we do about it? So, I mean, beyond grateful for that day that Dr. Baek came to us and said, I'm seeing this thing and it's definitely worth getting checked out. I was nervous about, Carly's my wife. I'm nervous about any surgery, anything going on with her body, I'm going to be nervous about. But going up to you, Dr. Nezhat, it literally took all of about 5 seconds.
That's what I was saying. We were nervous.
To have those nerves calm. You project an ease and a confidence about you, but not in a cocky way, not in a way that makes you go, oh wow, like this guy just thinks he's got some sort of God complex and is like, it didn't have any of those vibes whatsoever. And you even just sitting in your office and having you explain to us other alternatives, like, the surgery is not it if you don't want to go that route. Just sitting in your office and having you explain the gamut of what our possibilities were was amazing. But again, it probably took all about 5 seconds after we walked out that door to go, oh, of course we're doing this. we're gonna end up doing this.
We booked it, I think, there when we were there.
Yeah.
I think Zach and Carly, you guys are my PR agents. I mean, I have to tell you, I am very kind to say that. Thank you very much. But and you are very kind to say so. But it is interesting to see what you as a husband and wife, you guys, your story and also Scott and Roya as a complex, as a unit, how this affects the scenario and the decision making of supporting your wives. That is so important, and that's what I thank you for sharing your story.
Yeah, of course. Thank you. I cannot. There isn't a day that goes by. I'm being completely honest. There isn't a day that goes by that I don't see Jack and think to myself, Dr. Bett and Dr. Nejat. Like, thank God for them. It's true.
Well, that is the highest honor that a physician can receive. Yeah. So I was wondering if Dr. Baek has any comment essentially about the issues of their husbands, partners, and their support and how they affect the unit. I mean, what is your experience about supporting partners? Are there issues? And also, unfortunately, what Roya and also Carly specifically brought it up, because this is an area that you are ahead of the game of many other infertility specialists. And two issues you address, one of them is the denial of other specialists and conflicting data that the patient receive. And also, that's one area to see how you think it should be addressed, because what the mind doesn't know, the eyes don't see. And if you address that one, we would appreciate it, these two issues.
Right. I think that, bringing up the partner is a really big issue, especially during COVID when we're not allowing partners to come in. So this is like even worse right now because we don't allow partners to come in. It's our COVID protocol. And so I think people feel a little bit more separated. There's a lot more questions. And I think, when you're actually allowed to come into the office and you understand what's going on and you hear the information real time, it's a lot easier. So a lot of my patients are now FaceTiming their partners whenever we're in the office and doing ultrasounds. And I understand it's really hard. And one of the beauties of both Zach and Scott and, most partners who are in it, they really are protectors and they feel like, what can I do? They feel kind of helpless. And so I think that's that role that they have to really try to vet it. I think the biggest hindrance of this is what Carly mentioned, and I see it every day whenever I have to talk about endo and sending patients for surgery, is that other practitioners who aren't familiar with it really try to discourage my patients. And I just tell them, look, I am just trying to get you pregnant and optimize your cycle. I have no other reason to recommend the surgery. I'm an IVF doctor and I would love to just do IVF and embryo transfers and not take a break and send you off for surgery. But But when I'm recommending it, it's because I really think it's going to make a difference. So I do think that opportunities like this and educating is so important. You know, one of the reasons I do Instagram is not because I need patients. It's because I feel like there's a lot of bad internet sites out there, a lot of misinformation on social media, and I'm really just trying to combat that. There's a lot of women, unfortunately, who can't afford fertility treatments or in small towns who don't have access to good care. And so, you know, I really appreciate opportunities like this, but Dr. Nezhat, I think this is why educating and getting the information out there, even to general OBGYNs, internists, gastroenterologists, is really important. And that's really what I've been working on, but it goes slowly. Not everyone's ready to accept it.
You know, adding to Dr. Baek's point, when I told my gynecologist, you know, that I've been going to forever, that I have endometriosis and that, you know, this is why I can't get pregnant, he said, no, but you can get pregnant with endometriosis.
It doesn't cause infertility.
It doesn't cause infertility. And, you know, for me, and the other fertility clinic also said the same thing, is that, but you can get pregnant with endo. It doesn't cause infertility. It doesn't, you know, you can get normal embryos. And I think it's a, you know, has to be reiterated over and over, because yes, you can. There's tons of people who are going through that are not, and it can also be a cause of infertility and why you're not getting pregnant. So, you know, I heard that a number of times, but you could get with endo, and I'm like, yes, but if I could, I would have been pregnant. You know, it is a factor here, which I think a lot of people are blind to that. I don't think that they know about it. You know, like I said, my own gynecologist said, no, that can't be, because you can get pregnant with endo. So it's kind of a battleground that we had to, but we got here. Thanks to Dr. Nezhat and Dr. Baek. You guys really are amazing.
Thank you.
Well, I'd like to thank you very much. We have so many more interests and questions, but we are running out of time. I'd like to thank Dr. Kelly Baek, Scott, and Roya, and Anaya, Carly, Zach, and Jack for being so kind and spending the here in the West Coast, the Saturday morning, and for all of you viewers around the world for supporting the efforts of Worldwide Endomarch and raising awareness about endometriosis and helping patients, couples with endometriosis, their families, and as a result, the society. You have been wonderful in every aspect. These seminars, if you go to endomarch.org and touch the webinar session, you can follow the previous sessions, and also you can send your question to us if you have anything you would like us to address, because practically we have addressed all the issues. We also have, as Dr. Baek said, Instagram and TikTok session that we are raising awareness exactly for what Dr. Baek said. There are a lot of misinformation, unfortunately, so we try to express and show real facts for the follow-up. And we thank also the organizers of Endomarch, the Zoe Pennington, Barbara Page, and all the other staff, Melanie Salem, and also Genesis, for putting all these webinars. A lot of people are behind this, and we thank all of you, and we wish you, and of course, Dr. Baek and Dr. Agarwal, Dr. Tavallaee, and Dr. Lee. And if I'm forgetting everybody, I apologize. And I wish you the most wonderful weekend.
Great.
Forward.
Thank you. Great. Thank you, everyone.